My name is Lydia Waldron, and this is my VET 121 skills video. For aseptic purposes, begin by clipping the hair from around the cephalic vein of the front leg. You should first go with the hair, then against the hair, to keep the skin smooth and free of razor burn. Once the area is clipped free of hair, you need to scrub the site, alternating chlorhexidine and alcohol 3 times each. After the site is scrubbed clean of any contaminants, you are ready to insert the IV catheter. Your assistant holding the animal should be rolling off the vein where you will insert the catheter, bevel up, into the vein. If the catheter has entered the vein, you will see a flash into the stylet of blood. The blood should continue to flow to show that you are still in the vein. It is important to already have the tape out and on the table ready once you get the catheter in. When you get the catheter in, you place one thin piece of tape around the animal's leg to hold it in place. Then you would apply a cap with flush already inside. Next, apply your tape and possibly cotton padding if the patient is going to be spending time at the hospital. Finishing it off with vet wrap and a final flush with sterile saline to make sure that the catheter is still patent in the vein. If any blood spilled during the placement of your catheter, make sure to clean off that area off your patient. Open gloving is used in assisting minor surgeries such as small mass removal. You would scrub in just like you would for closed gloving. Then you would open the inner wrap to expose gloves, keeping gloves sterile. Instead of using your gown sleeve to touch the sterile glove on the left, you would grab the inside of the glove that is exposed and slide your sterile hand into the glove. Sometimes it is tricky to get the outer wrap to stay open when trying to glove. Make sure that you do not touch the exposed part with your sterile hand. To get your right glove on, you would slide your gloved fingers under the folded glove and pull it onto your hand to make sure that you do not contaminate either glove. Start out by opening gown pack by touching only the outer plastic. When making this video, I forgot to flip over the gown pack at first, which would be a problem after I scrub because I will need the sterile towel. Next, I will open the glove pack in the same manner, only touching the outside of the pack. Make sure you are patient because sometimes the packs will break open and you don't want to touch the inside sterile part. You will apply a surgical cap to your head with all hair tucked underneath. Proper attire for surgical assisting includes fresh scrub suit tucked in, surgery shoes not exposed to the street with surgical booties over top, no jewelry, no fingernail polish or long nails. Then you will apply a surgical mask tied firmly to your head with no gapping. Like I said before, it is important to have the gown pack flipped over so that the sterile towel is ready to be used after scrub. Hand scrubbing is a very important part of keeping sterile while preparing for surgery because oftentimes gloves can be punctured during surgery. A scrub brush can be used with non-irritating scrub soap already present in the packaged scrub brush. Start by removing any dirt from underneath your fingernails. Starting with the left fingertip and scrubbing around each side of the finger at least 10 times, working from fingertips to fingers to palms to wrists to arms to about 3 inches below the elbow. After you scrub one section of one hand, you go to the other hand before starting a new section. It used to be said that you should scrub for 10 minutes, but now with the advancing scrub soap, it is believed that 5-minute scrub is sufficient for the first scrub of the day. Rinsing hands can be a little tricky, especially if the sensor on your sink doesn't want to turn on like mine. Keep in mind your hands should never fall below your waist. Once the water is on, slide your hands across the water, fingertips to elbows, again never letting your hands fall below your waist. Once the soap is rinsed off, you can let the water drip off from fingertips to elbows, keeping your fingertips facing the ceiling. Next, grab the sterile towel on top of the already opened gown pack without contaminating your hands. Pat your left hand using the top half of the towel and your right hand with the bottom half of the towel. Then finally drop the towel without your hands falling below your waist. After you are completely scrubbed in, you can remove the gown from the pack by touching only the inside collar of the gown. You should pull the gown out of the pack and lightly shake it, making sure that it doesn't touch any of the non-sterile environment. Do not pull your hands all the way through the end cuffs because you will need that to close glove. Without touching the outer surface of the gown, an assistant will have to come tie the waist and secure the neck of your gown. An assistant will have to open your glove pack without contaminating the gloves inside. Closed gloving can be a little more complicated because you have to use your fingers inside the cup in order to get the glove on. Start by grasping the left glove with your right cuffed hand. Once you are able to slide your cuffed hand into the left glove and getting each finger into the finger of the glove, you can pull back on the end of the glove to secure it onto your arm without contaminating the sterile glove part. With your left gloved hand, slide your fingers underneath the folded glove part and place your cuffed right hand into the glove, getting your fingers into each of the gloved fingers, to then pull back on the end of the glove to secure it onto your right arm. When helping a doctor scrub in for surgery, make sure that her gown pack and gloves are open and ready for her when she is done scrubbing. Once the doctor puts on her gown, you can hook the gown, attaching by the neck, only touching the inside of the gown. After that, you can tie the waist. Just make sure you don't tie it too tight for when she is trying to glove. Important to never cross into the sterile field of the surgeon when you are non-sterile. You should always walk behind the surgeon, and when you are sterile, you should go back to back with the other sterile person. Once the doctor is finished her closed gloving, she will need you to finish securing her gown. She will do that by handing you the front card, which you will hold on to while she spins around, and then you will hand the card back to her, where she then will tie the gown in front. When in surgery, you should be stationed across from the surgeon and place the instruments in the appropriate spot that they usually are so the surgeon knows exactly where each of her instruments are located. If any of the instruments have an excess of blood or fluids, you should wipe the instrument off using a sterile technique. You will grab the drape without touching the outside pack and hand it to the surgeon. The surgeon will then shake out the drape and cut a small fenestration depending on what type of surgery you are going to be doing. Without letting the drape touch any of the contamination, you will lightly shake out the drape and then place the fenestration over the spot where the incision will be. Next, you will place a towel clamp on each corner of the fenestration, including a small part of the skin, to make sure that the drape is securely attached to the animal. To apply a scalpel blade to the scalpel handle, you will grab the blade first with one hand, then grab the needle holders with another. Once you have grasped the blade with the needle holders, you will apply it to the handle. It is a little bit tricky, but if you're patient, you can easily get the blade onto the handle. When assisting a doctor in surgery, they will often have you complete many duties, such as blot the incision site, like I am doing here. It's important to blot the site, not smear the excess blood throughout. The doctor can also have you complete other duties such as retract tissue, lavage tissue, and cut suture. While waiting for the doctor to give me other orders, I stand with my hands above my waist in a clasped position to make sure that I do not contaminate myself in any way. Also, when working with the surgeon, I do not allow my gown to touch the table at any time. When a doctor requests an instrument, it is important to hand the instrument handle down firmly into the surgeon's hands so that the instrument cannot bounce out or cut the surgeon in any way. As the assistant to the surgeon, it is important to repeat back which instrument you are handing to the surgeon so they know exactly what you are giving them. At this point, I cut the suture exactly where the surgeon tells me to cut. When you are assisting with surgery and you are not scrubbed in, it is important to maintain aseptic techniques and be extra aware of sterile fields. Handing the doctor a drape or opening the end of the laser, it should be done away from the sterile pack and not over the patient. When the doctor directs you to get her suture, you should know each of the sutures and which one she is asking for. Once you have gotten the appropriate suture she requested, you can place the suture open in the sterile pack. Before preparing your patient for surgery, you must set up the operating room so that it is ready to go when the patient is ready to ensure that the patient has no extra anesthesia time. First, place a trough on the table covered by a towel to keep the patient in place while operating. You can then arrange lights over the table, but you might need to fix the lights once the patient is set on the table. Next, set the table heater to about 100 degrees to prevent hypothermia while the patient is in surgery. Don't forget to adjust the table based on the size of the animal or doctor preference. Once the table is set for the patient, you can set the sterile pack specific for that surgery onto the Mayo stand. Finally, you can get out the surgeon's gown and glove pack, cap, mask, and booties. When preparing a patient for abdominal surgery, such as a spay in this case, it is important to clip all the hair from the area around the surgery spot. You should be generous with your clipping and make sure the edges are even so that the owner doesn't think badly of the staff or think that we were rushing. You can first go with the direction of the hair, then go against the direction of the hair to ensure a smooth, abrasion-free site. Once you have finished clipping, you can use a small cordless vacuum to vacuum the rest of the hair off of the animal. Scrubbing should be done in the operating room to ensure that nothing is transferred onto the site walking from the treatment area to the operating room. In my hospital, we will sometimes scrub extremely dirty rescue dogs in the treatment area and then do another thorough scrub in the operating room. Wearing gloves, alternating between Chlorhex and alcohol, you would do a circular motion from the inside, working your way outward. You will repeat this about 5 times for each. And in this case, for my video, I only used chlorhexidine because the doctor will be using a laser for the surgery. Scrubbing for too long or for too hard can make abrasions on the skin. When walking the patient from the treatment area into the OR, you should make sure you have someone to carry your pole or help you carry the animal if it's too big. The pole should be placed on the opposite side of where the surgeon's going to be standing, across from the anesthesia machine. Next, secure the patient to the table using the ties on each corner of the operating table. Once the patient is secure and centered on the table with the lights in place for the animal's location, you can begin hooking up the patient to the ECG machine. To gather a small blood sample for, in this case, a heartworm test, you would have an assistant hold the dog and roll off the vein while you extend the front leg of the dog forward with one of your hands, then spray the alcohol to clean off the spot and help see the vein more clearly. Once you have a good feeling of where the cephalic vein you will use, you will insert the needle, bevel up, and pull back the amount of blood you need. For an intramuscular injection, you can use many different locations based on the preference of who is giving the injection. In this case, I used a back hind leg muscle. Once you have isolated the muscle you are using, you can spray alcohol onto the area, then apply the needle into the muscle, then aspirate it back to make sure there is no blood present. If blood is present, that means you are in the vein and need to remove the needle and find a different spot. You must know exactly where you are inserting the needle into the muscle, because if you accidentally insert it into the sciatic nerve, it can cause severe problems such as paralysis.